Good morning, ladies and gentlemen, and welcome to the first Connect Liberia Africa webinar series COVID-19 Liberia Response. My name is Cynthia Blanford. I'm President and CEO of Global Strategies for Good, LLC. And I also have the honor and privilege of serving as the Honorary Consul General for the Republic of Liberia in Atlanta, Georgia. We do apologize for the late start today. We had some technical difficulties. But we thank you for joining us this morning for an exciting and important webinar. Before we begin, I would like to take this opportunity to send our prayers to all those who have been affected by the coronavirus, including our own Ambassador George Patten, who is now healed 100% from the virus, and he's joining us today. We also send our condolences to the thousands who have died from this deadly virus. Please let us take a moment of silence in honor of their lives. Thank you. I also want to take this opportunity to thank the organizers for the support in helping to plan the webinar today, including our sponsors, the Liberian Consulate in Georgia, Global Strategies for Good, LLC, the University Consortium for Liberia, J. Lane Media, and Icon Filmworks, LLC. A special thanks and appreciation to our Connect Liberia planning team, Candace Bazemore, James Hammond, Dr. Saki Gulafali, and Chris Berries. Thank you for your leadership and your support. As COVID-19 cases are on the rise in Liberia and other countries on the continent of Africa, as of September the 7th, 2020, current reports from Johns Hopkins University, using statistics from the World Health Organization, confirmed that COVID cases from 55 African countries have reached 1,299,656, with reported deaths at over 31,000 persons. The recoveries are 1,036,177 recoveries. This webinar today will explore how the Diaspora is responding to help support the coronavirus healthcare crisis in the Republic of Liberia and how you can get involved. The webinar format will open up with a keynote address from the Liberian Ambassador to the United States in Washington, D.C., His Excellency George S.W. Patten Sr., who will share the launching of the COVID-19 Diaspora response team that he has established. Then we will have our distinguished panelists discuss their COVID-19 efforts, including the unique partnerships that have evolved in the fight against this pandemic. We will then have a discussion and take a few questions from the chat line. So if you have questions, the chat line will be open, and we'll do our best to answer as many questions as we can. Finally, we will have a call to action by the ambassador and then discuss how you can get involved. Today, in addition to the Liberian Ambassador to the USA in Washington, D.C., His Excellency George S.W. Patten Sr., our outstanding panelists will include Honorable Rudolph Sherman Jr., Consul General, Republic of Liberia in New York, Honorable Jackson George, Honorary Consul General, Republic of Liberia in Minnesota, the former Ambassador to the United Nations, former Mayor of Atlanta, former U.S. Congressman, Honorable Andy Young, Chairman of the Board of the Andrew Young Foundation, and the Honorable Bishop, Dr. E. Earl McCloud, Jr., 14th Episcopal District of the African Methodist Episcopal Church. Unfortunately, as our Liberian nurses are on the front lines today, fighting the virus in America, remarks from Amelia Togba Addy, President of the Liberian Nurses Association, USA, and Tony Nimley, Vice President of Operations, have been pre-recorded and will be shared with you later today. They're not able to join us live, but we will share their remarks and goodwill messages later on. So let's get started. Ambassador George S.W. Patten Sr. is a career diplomat with more than 2 decades of experience in the Liberian Foreign Service. He served in various capacities at the Liberian Ministry of Foreign Affairs and rose to the ranks of the Liberian Foreign Service. Prior to his appointment as Ambassador Extraordinary and Plenipotentiary of Liberia to the United States of America, Ambassador Patten served as Ambassador to Ethiopia and Kenya and Permanent Representative to the African Union and the United Nations Economic Commission for Africa. He previously served as Minister Counselor in charge of political and legal affairs at the Permanent Mission of Liberia to the United Nations, His functions were many. It included coverage of the United Nations Security Council, the African Union Observer Mission to the United Nations, expert in the 4th and 6th Committees of the United Nations General Assembly, peace-building expert and focal point for the Liberian country-specific configuration on the agenda of the Peace-Building Commission, PBC, focal point on the New Deal for engagement in fragile states, focal point for the responsibility to protect R2P, focal point for peacekeeping activities, and the list goes on and on. He has a respectable career in the Foreign Service. Ambassador Patten has a master's degree in international relations from the University of Liberia, a bachelor's degree in law from St. Mary's University College in Addis Ababa, Ethiopia, and a bachelor's degree in business administration from the University of Liberia. He has certificates in diplomacy, public international law, and conflict management and resolution. Welcome, Ambassador Patten, to the webinar. Can you hear me all right, Ambassador? Hello, sir. Can you hear us? He's connecting. I see there's a connection to the audio. We are going to allow him to come in. We've had some technical difficulties in Washington on the ambassador's line. Ambassador, can you hear us all right this morning? Ambassador Patten? Not sure. We have had some difficulties with his line. Ambassador Patten, can you hear us? So if we're not able to get him, he's joining by audio and by phone. Ambassador? We can't hear you. Ambassador Patten? He said he can't hear. I'd let our technical team please work with him on getting the ambassador back online. We're not sure what the technical difficulty is. But at this time, Ambassador, we will move on and bring you in. Can you hear me? So we'll let our technical team work with you. I see it's connecting, but the bandwidth may be very slow. I'm watching it on the internet. So Ambassador, we'll come back to you shortly. We'd like to go ahead now and introduce Ambassador Young. Is everybody still with me? Thank you. Many thanks, Ambassador Young, for joining us today, and welcome to the webinar. Good morning, and we're happy to have you to join us with your busy schedule. First, let me start out by saying thank you on behalf of the government and people of Liberia for facilitating the donation of 100,000 tablets of selenium sent from Germany to the Minister of Health in Liberia a few weeks ago. Your humanitarian efforts were outstanding, and we appreciate you for this. Please let me also recognize the president of the Andy Young Foundation, Mr. Kumar, for his outstanding leadership and support to ensure that the donation was delivered to Liberia, and to all the other partners along the way who helped us to get this delivery to Liberia just in time. A special thanks also to the manufacturer of selenium, Biosyn Company, for a true collaboration. Ambassador Young has earned worldwide recognition as a pioneer and a champion of civil rights. Ambassador Young's lifelong dedication to service is illustrated by his extensive leadership of over 65 years, serving as a member of Congress, U.S. Ambassador to the United Nations, Mayor of the City of Atlanta, and ordained minister, among other positions. During the 1960s, Young was a key strategist and negotiator during civil rights campaigns that led to the passage of the Civil Rights Act of 1964 and the Voting Rights Act of 1965. Appointed as an ambassador to the United Nations in 1977, Young negotiated the end to white minority rule in Namibia and Zimbabwe, and brought President Carter's emphasis on human rights to international diplomacy efforts. As two-term mayor of Atlanta, Ambassador Young brought in over 1,000 businesses, over 70 billion in foreign direct investments, and generated over 1 million jobs. Ambassador Young has received honorary degrees from more than 100 universities and colleges in the US and abroad, and has received various awards, including Emmy Lifetime Achievement Award in 2011 and the Dan Sweat Award in 2017. His portrait also became a part of the permanent collection of the Smithsonian National Portrait Gallery. Ambassador Young also serves on a number of boards, including but not limited to the Martin Luther King Center for Nonviolent Social Change, Morehouse College, and Andrew Young School of Policy Studies at Georgia State University. He and his wife, Carolyn McLean Young, founded the Andy Young Foundation to support and promote education, health, leadership, and human rights in the US, Africa, and the Caribbean. Young currently serves as the chairman of the Andy Young Foundation. He retired from Good Works International in 2012. He was born in New Orleans. We're waiting on that great gumbo to come. And his wife, Carolyn McLean, and 3 daughters and 1 son. He's a grandfather of 9 and a great-grandfather of 1. Welcome to the webinar, Ambassador Young. Thank you so much for joining us this morning.
Well, thank you for having me.
Thank you so much.
It was really an accidental privilege that got us involved with Liberia. We were studying selenium here in Georgia. Selenium was a trace mineral that seemed to be blocking the growth and expansion of the Ebola virus. The Ebola virus, along with the coronavirus and influenza virus and HIV and hepatitis, there's a whole family of viruses. And our research done at first the University of Georgia and then at University of North Carolina in Greensboro, and shared with scientists from England and Germany and China. And so since there was no known cure, we thought that the best we could do is work to strengthen the human immune system. These viruses have probably been around for a long time, but maybe when we used to eat the stuff that we grew or get our food directly from the dirt to the table, we had a little more vitamins in it and it didn't affect us as much. But it seems that selenium does perform some function in slowing the growth and expansion of the virus. And so simple things like drinking water, taking a dose of selenium, vitamin C. Tyler Perry has given all of his actors and actresses at his studio here in Atlanta, he has stocked them up with vitamin D3. But nobody for sure has a cure. And so the thing that we've tried to emphasize is keep yourself as strong as you can. Drink water, fruit juices, vegetables, get some exercise, walk up and down hills or steps, making your lungs breathe heavy. All this seems to keep us in better condition and enables us to fight off any of these viruses that seem to be affecting the planet now. They probably have all along. We just didn't know it. There was no such thing as a webinar that would let us talk about it. So thank you very much. It gives us a chance to talk about it. We remember Liberia being on the front cover of Time magazine in the Ebola crisis. So we followed up with the help of Alex Cummings, who happened to be heading there with a Coca-Cola plane 5 years ago. This time it was a little more difficult, but we were able to get it from Germany and have it shipped to Liberia. But in the meantime, all we can do is work and pray. I say this was a coincidence that we happened to be able to get, actually the first time we bought the selenium from Walmart. and it's not that expensive, but we were able to get all that they had and put it on Alex Cummings' Coca-Cola plane. And we were pleased that you were pleased with the results.
Yes.
And so I always say that coincidence is God's way of remaining anonymous.
Yes.
And so these coincidences, you're calling us and asking us, could we help again, and being able to find it through Germany. Well, we're glad to be able to be of service, and hope that whatever you learn from this, you can share back with us, because we still have a long way to go with all of these viruses.
Thank you, Mr. Ambassador. Thank you so very much. Again, we appreciate you on behalf of the people in the government of Liberia for your contributions of the 100,000 selenium tablets. Thank you so much. Now, understand from my technical team, Ambassador George Patten, I think, is available now for his keynote address. Ambassador, can you hear me? Okay, I can't hear.
Can you hear me, Sergio?
Yes, sir. Good morning. Yes, sir. Good morning. We're very happy to see you and to hear you. Thank you so much.
Thank you. Thank you.
You're most welcome, sir. I'm going to turn it over to you. You have your 10-minute slot, and we've done a gracious introduction. So please, sir, we'd be happy to hear from you in the keynote. Thank you, Ambassador.
Thank you very much, Cynthia. And I want to thank Ambassador Young, the bishop, and the folks on the platform for the understanding. We had this technical problem a couple of minutes ago, and I'm glad we've resolved it. And so let me begin. Bishop Dr. Earl McCloud, 14th Episcopal District of the African Methodist Episcopal Church, presiding over Liberia, Togo, the Ivory Coast, and South Africa. Ambassador Andrew Young, Chairman, the Andrew Young Foundation, Honorable Rudolph Sherman, Consul General of Liberia in New York, Honorable Jackson George, Honorable Consul of Liberia in Minnesota, and our own sister and host, Honorable Cynthia Blanford, Honorable Consul of Liberia in Atlanta. Our online audience, distinguished ladies and gentlemen. I wish to express sincere appreciation to Honorable Cynthia Blanford for the invitation extended to me and the Global Strategies for Good, LLC, and the University Consortium for Liberia for collaborating to host this webinar on Liberia's COVID-19 response. It is no secret that COVID-19 has overwhelmed more advanced healthcare systems in many countries and brought the economies of several developed countries almost to a complete halt. Liberia is no exception. On March 16, 2020, Liberia recorded its first confirmed case of COVID-19 and moved from the precautionary stage to a containment stage. Before then, the government of Liberia, through the Ministry of Health and the National Public Health Institute of Liberia, developed a national preparedness and response plan in February 2020. The overall goal of the plan was to provide a strategic framework to prevent COVID-19 from entering Liberia, and if it did, to quickly detect, isolate, and respond in order to mitigate the impact of the outbreak in all parts of the country. The plan included measures for social distancing, testing, and tracing, hand washing, etc. The plan is divided into technical areas: coordination, logistics, point of entry, laboratory capacity, risk communication, and community engagement. Case management, rapid response teams, surveillance, and infection prevention and control. The National Public Health Institute operates as the lead operational agency for government's response under the leadership of the Ministry of Health. The command and control structure of the Liberian National COVID-19 response includes strategic multi-agency coordination, national incident management system, and the county-level incident management system. The strategic multi-agency coordination platform is chaired by the National Disaster Agency and co-chaired by the Ministry of Health and Ministry of Internal Affairs. The platform coordinates with all national agencies and hosts meetings in the fight against COVID-19. The incident management system is headed by the Ministry of Health. It oversees an integrated technical operational preparedness against the virus. The Ministry of Information, Culture, and Tourism handles communications on response and the security services ensure that the implications of the response are well managed and do not disrupt peace and security. In April, President George Manning, President Weah appointed Madam Mary Bro to serve as the National Response Coordinator for the Executive Committee on Coronavirus in Liberia. Madam Bro was charged with providing supervision toward a single set of national strategic objectives for defeating the coronavirus disease. She also coordinates the National COVID-19 Multi-Sectoral Response Plan in coordination with the United Nations donor partners, Ministry of Health, and National Public Health Institute of Liberia. To diminish the spread of the virus, the government of Liberia took measures including the suspension of mass gathering and encouraged social distancing. The Ministry of Health declared a national health emergency on March 22nd and issued several rules and regulations to join global efforts to combat the coronavirus pandemic. The Civil Service Agency also announced that only 25% of government officials should be present at workplaces to minimize physical contacts and the possible transmission of the virus, while the remaining 25% will benefit from paid corona leave. The international airport was closed. The government ordered that all schools and religious places should also be closed. As infection levels increased on April 8, 2020, His Excellency Dr. George Weah, President of the Republic of Liberia, declared a state of emergency, which was endorsed by the 54th Legislature through a joint resolution to stop the spread of the pandemic. Under the state of emergency, lockdown was introduced to control the movement of the population and spread of the virus. The state of emergency has since been lifted, but some COVID-19 protocols remain in place. Critical to the lockdown and other measures taken to mitigate the spread of the pandemic is its effect on the local economy, in particular, macroeconomic stability, balance of payment, tax collection, debt repayment, financial stability, reform initiatives such as the IMF ECF program, and social welfare plans. The Liberian economy was recently projected to expand at a rapid rate in 2020, or 1.4% up from the contracted growth reported in 2019. The medium-term outlook from 2021 to 2024 proved initially promising, with growth averaging at around 4.4%. That has all been wiped out now by the outbreak of the pandemic. This has exacerbated social vulnerabilities. Addressing these critical issues requires strategic interventions to boost the health sector, stimulate the economy, and provide direct budgetary support. In the face of this debilitating situation, I reached out to the State Department and to members of Congress for help. The U.S. was kind to provide through USAID critical funding. I also reached out to Liberians in the diaspora and appealed to them to help their country. We have had the Liberian Business Association, USA, the Union of Liberian Associations in the Americas, ULA, the National COVID-19 Task Force, the Federation of Liberians in Canada, FLAG, and the Liberian Association of Canada, LAG, joining our coordination efforts to provide food and medical relief to hospitals and communities in Liberia. I recall my telephone conversation with Ambassador Young a couple of months ago about what he and his foundation could do to help Liberia. Honorary Consul Center of Blandford was at the center of arranging the call. I am glad that that effort paid off very well, as Ambassador Young, through his foundation, was able to send a huge consignment of selenium to the Ministry of Health in Liberia. Ambassador Young was also involved with the effort to defeat Ebola in Liberia a few years ago. In this public manner, On behalf of the government and people of Liberia, I wish to thank Ambassador Young for this kind assistance to the people of Liberia. Meanwhile, the Liberian government, in collaboration with the World Food Program, WFP, is providing critical food items to Liberians across the length and breadth of the country. This has been indispensable to ensuring that vulnerable citizens can find food to eat during these critical times. On June 28, 2020, Liberia opened the international airport for travelers. COVID protocols of temperature test taking, washing of hands, and social distancing are enforced at the airport. Lipstick. In June, a consortium of Liberian private sector, the Liberian Private Sector Executive Committee, launched a virtual web portal intended to assist the government of Liberia keep track of private sector donations in support of the country's COVID-19 response. The portal is designed to collect data about private sector contributions irrespective of the size or the source of the donations, or whether they are in cash, in kind, or in hours. This will allow the donations to be potentially available for international donor matching funds for support to most vulnerable Liberian society. This coordinates the work of the Private Sector Executive Committee under the direction of an incident management system in collaboration with the efforts of the West Africa Coronavirus Platform, Liberia WASCOM-19, directed by Scott Lowy, the CEO of ArcelorMittal Liberia. WASCOM-19 is using the experience gained through the private sector mobilization group in the fight to defeat the Ebola outbreak of 2014 to 2016. USAID has challenged, USAID, has challenged the private sector that it would make available for matching US $4.6 million to implement development programs in Liberia in support of communities deeply affected by the pandemic. The private sector contributions will be accounted for and validated by LIPSEC. The project is similar to one undertaken during the outbreak of Ebola, which provided support for social protection systems and helped the poor and vulnerable. The private sector and the Liberian diaspora were crucial partners in this venture. The LIPSEC portal can be used by any business or individual to log into a secure site, document the contributions they have made to support Liberia in this fight against COVID-19 from the beginning of the disease arriving in Liberia. I encourage partners and friends of Liberia making contributions to the defeat of coronavirus to sign up to the portal at www.lipsec.org. To donate, you have to do a few things. Just click on donate on the donate icon, enter your phone number, and immediately you will receive a text message with notification code. Put in the code and the window will open to make your donation. You can put in your name and type donation. The process will open for you to make your donation. As of September 2, that is just the day before yesterday, 2020, Liberia has 1,311 confirmed coronavirus cases, 82 deaths, and 1,194 recoveries. In closing, I wish to thank the U.S. government again for their continued support to Liberia. I also recognize the significant contributions of Liberian diaspora and we should encourage them to continue their support to Liberia. I wish to call on the Friends of Liberia institutions and humanitarian organizations to help Liberia defeat COVID-19. I thank you very much for your kind attention.
Thank you so very much, Ambassador Patten. Outstanding. Your leadership in this area has not gone unnoticed. We are so excited to be a part of your task force, your leadership team, to help combat the coronavirus in Liberia. The listening audience, again, please go to www.lipsec.org. lipsec.org. It's a very easy process, the portal, and you all hours, in kind, cash, volunteer time does count. We need to make sure we're maximizing on the leverage and the support from the diaspora. And we're also working very closely with Ambassador Young and his president, Mr. Kumar, to ensure that the donation of selenium is counted toward this match. So Mr. Kumar and I are working on that right now, and we certainly hope to be able to make that contribution along with the AME Bishop and the Liberian Nurses Association. So Excellency, thank you so very kindly. And we'll get back to you a little bit later on in the program for the call to action. So we're going to move on at this time. I'd like to welcome, introduce a good friend and colleague of mine, Honorable Rudolph Sherman Jr., the Consul General, Republic of Liberia in New York. Good morning to you, Honorable Sherman, and welcome to the webinar.
Good morning. Thank you.
Thank you so much for joining us. I'm going to be reading your bio, and then we'll go right into the questions section.
Thank you.
Honorable Rudolph Emmett Sherman Jr., a career Foreign Service officer, began his diplomatic career in 2005 when he was appointed to serve as Second Secretary Vice Consul at the Embassy of the Republic of Liberia in Beijing, the People's Republic of China, until his promotion as at post as Consular for Commerce in 2011 until 2013. Later in 2013, he was transferred to the Consulate General of the Republic of Liberia in New York and promoted as Deputy Consul General in September of 2013. In August of 2014, he was again appointed and promoted at post as Consul General in New York. Honorable Rudolph Emmett Sherman Jr. was born and raised in Monrovia, Liberia on June 28, 1973. He's happily married and has a beautiful family of 4 children. He received his Associate of Arts degree in Business Administration from the Howard Community College in 1998, and he also holds a Bachelor of Arts degree in International Business from the University of Baltimore, Maryland, 2001. Honorable Sherman, on March 16, 2020, the Republic of Liberia confirmed its first COVID-19 case and reported its first death on April the 4th, 2020. His Excellency George Mena Weah declared lockdown measures, including suspension of all non-essential travel, and curfews were ensured. Schools were closed across the country, and churches, mosques, and bars and beaches were also closed. A state of emergency, as the ambassador has mentioned, was declared. However, Liberia was one of the first countries to start screening passengers for COVID-19 at the airport. The state of emergency has now been lifted. However, despite these measures, the number of COVID-19 cases continue to rise. Honorable Sherman, over the years, the consulate in New York has worked closely with the diaspora on many initiatives, including education, trade, and healthcare. How is the consulate in New York today engaging the diaspora in regards to the coronavirus? Please respond. Thank you.
Thank you, Cynthia. Since the onset of COVID-19, the consulate got engaged immediately to try and accomplish a couple of things. One was to meet the ambassador's demand on us to contribute, to also talk about donations, and also to spread this word of safety in our larger Liberian community. So, for example, in the New York area and New Jersey, we have several smaller Liberian associations. For example, we have the Staten Island group, very robust. We have the Harlem. And then in New Jersey, we have the Liberian community of Newark, and then another large one in Trenton, New Jersey, in the south of New Jersey. And we engage all of these different groups with the hope that they would join us and start some drives for gloves, face masks, for whatever it is that was necessary that we could contribute. And that was also very fruitful. Within the Liberian communities also, in addition to being partners to us, they've done drives to raise awareness and safety, to donate sanitizer to local Liberian families in an effort also to promote safety among our own Liberian community. And again, it's been very fruitful because we were able to get donations of gloves, donations of face shields, And so far we've turned that over to the embassy, at least the face shields to the embassy to forward on to Monrovia to help the cause.
Thank you very much for your outstanding efforts. We know this is an ongoing effort in the community. We know that everyone who has you've reached out to is participating at some level. So continue the great work, and we'll come back to you with another question toward the end of the webinar. At this time, thank you so much. I'd like to welcome to the webinar Honorable Bishop McCloud. We appreciate you being with us this morning. I'd like to read a specific statement on behalf of the Consulate Office. We'd like to say a special thanks to Bishop McCloud. So on behalf of the government and the people of Liberia, we want to thank you publicly for your outstanding support of Liberia over the years. As the presiding bishop over Liberia, Togo, Benin, Nigeria, Ghana, Sierra Leone, Cote d'Ivoire, and South Africa. During the coronavirus, you have continued your contributions to support the American Methodist Episcopal University, AMEU, with financial resources for faculty and the like. AMEU is such an important educational institution in Liberia, and we thank you for your outstanding leadership. Bishop Earl McCloud Jr. is a native of Clio, Alabama. As a student, he was an activist during his days at Clio Public High School and at Tuskegee Institute in the political campaigns of State Representatives Thomas Reed and Fred Gray. Bishop McCloud is a strong supporter of preparation for ministry and all other undertakings in life. He has attained a BS degree, 2 master's degree, and the Doctor of Ministry degree from United Theological Seminary in Dayton, Ohio. Bishop McCloud believes that things just do not happen on their own. Things happen when people make them happen. Therefore, you are either doing something or getting out of the way. From 1974 to 1984, Bishop McCloud served in the United States Army. Bishop McCloud has developed significant business relationships with the secular community, which has produced a variety of funding for books that have benefited the 14th Episcopal District. He's renovated Episcopal residences and so forth and so on. Bishop McCloud was assigned by the 50th quadrennial session of the AME Church General Conference to serve the 14th Episcopal District in West Africa. And he's doing an outstanding job. He is a sports enthusiast. He's married to attorney Patricia Russell McCloud, international motivational speaker and author. Welcome to the webinar, Bishop McCloud, and we're very happy to have you. Bishop McCloud, when we approached you a few months ago to brainstorm on how your good office could assist Liberia in its fight against the coronavirus, you immediately said yes and agreed to work hand in hand with the Liberian Nurses Association, USA, to develop a unique partnership to jointly raise funds to support the need for PPE, ventilators, and other healthcare support. Bishop, recognizing that Liberia has a fragile healthcare system, and it has been reported that there are under 10 ventilators in Liberia, please describe why it was important for you and the church to get involved. Thank you.
Well, thank you. Good morning, everybody. The AME Church has a large investment financially in Liberia in AME University. AME University is to Liberia as Tuskegee Institute was and is to the state of Alabama and to the nation in the United States. The track record of the Liberian Nurses Association was easy to connect with because of the way they worked with the Ebola crisis. So joining hands with them in this project and doing what the church could do by connecting with them and our people on the ground in Liberia was a very easy decision. The wonderful people of Liberia really want to learn, and they want to study, and we want to be guilty of helping to provide those kinds of opportunities. Nelson Mandela said in his autobiography, for Africans, and I think specifically he was thinking of South Africans when he said this, but I think in my service on the continent, I can clearly say, as he said, for Africans, it is not a lack of ability, it's a lack of opportunity. The AME Church wants to be guilty of providing opportunities for persons who would not otherwise have those opportunities to obtain an education, to be in better health, and to serve. This coronavirus has caused a lot of problems since the lockdown, and the church has to speak to those problems. Specifically, the lockdown has, and all of the churches in Liberia now have joined together, and we're asking the government to help us address some of the problems specifically that have increased as a result of the coronavirus. So partnering with the Liberian Nurses Association was a very easy thing for us to do. And it gives us another opportunity to invest in the church's most precious assets, and that's his people.
Thank you, Honorable Bishop McCloud. And later on in the program, we have a wonderful announcement that the bishop will be making, and not only in terms of how you can get involved and make a contribution on the website, www.amec14.com, but he also has a great announcement in terms of the number of masks that have been donated to the cause. So we'll let him make that announcement a little bit later on in the program. At this time, I'd also like to introduce a good friend and colleague of mine, Honorable Jackson George, the Honorary Consul General, Republic of Liberia in Minnesota. Welcome and thank you, Honorable George, for joining the webinar today.
Thank you.
Welcome. Honorable Jackson George is an entrepreneur and motivational speaker who transformed his business experience into thought-provoking, interactive agents of change. He's a graduate of Concordia University with emphasis in organizational management and leadership. Honorable George is the Honorary Consul General of the Republic of Liberia in Minnesota, USA. He is the founder and chief executive officer of Comfortable Living, Inc., a healthcare provider, and the founder and CEO of Strategy Africa, Inc., a consultant company in the USA. He is also the president of the Liberian Business Association in the Diaspora. He's a member of the board of directors for the Minnesota Africa United, MAU, an African advocacy group that caters to the welfare of African immigrants in Minnesota. He's also a member of the Minnesota Malaria Community Advisory Board. He's an active motivational speaker who inspires people with culturally sensitive, thought-provoking methods for change. Honorable George, I recall that when Ambassador Patten called together the Liberian consulates to participate in the COVID-19 response task force, you were instrumental as the president of the Liberian Business Association USA to reach out to the Liberian Business Association in Liberia and the Liberian Tailors Union to strategize on how Liberian tailors and the Business Association could take on a leadership role in designing and producing facial masks. Please describe how this partnership was established and how your project is coming along and what future growth potential you see moving forward. Thank you.
Thank you, Cynthia, and thank you to all of the panelists, Honorable Ambassador. When the ambassador initiated, when the COVID-19 came in, the ambassador initiated the task force, we felt it necessary that at the time, planes were not flying, supplies were not entering the continent, and we felt that we had resources in Liberia at the time to begin the process of slowing down COVID. So we have a partnership with LIBA Liberia. We have a memorandum of understanding to be able to work through LIBA. So we contacted LIBA Liberia, asked them to contact the Tailor Union, and we wanted to produce enough masks to ensure that marketers were wearing masks because we felt that Liberians at the time would still have to find food to eat. And we felt that if all the marketers had masks on to reduce the spread, we would have been helping the situation while the government were looking at other ways of working to reduce COVID in our homeland. And so we believe that the Liberian Business Association in the diaspora is a strategic partner in rebuilding our homeland. And so one of the things that we've done is to identify the resources we have in the diaspora and to see how we can partner with businesses in Liberia to start doing real business. And so I want to use this time to thank the Liberian businesses in the diaspora for coming up with the funding to support the production of masks. At the time, we are saying, if we can start producing masks in Liberia and we can perfect it, we can export masks. And so that's something that we are looking forward to. And the short-term plan was to create the environment to have our marketers have masks, but the long-term plan is to perfect it and even supply medical masks in our homeland.
And thank you, Honorable Jackson George. We just believe under your leadership that this will come to pass. It's a great opportunity to engage the tailor unions and the market women and working with Libre Liberia and all the great work that's to come. There's really a great opportunity to export these masks. We have great tailors in Liberia, and we thank you for your leadership. At this time, we're going to the second question, and we'll bring this Ambassador Young in for the next question. So Ambassador Young, during the coronavirus pandemic, Africa became isolated and gaining access to medicines was limited due to travel restrictions and shortages of medical supplies and equipment worldwide. According to the African Development Bank, Africa only has 375 pharmacy companies for a population of over 1.3 billion people, while India has 11,000 and China has 7,000 pharmacy companies for combined populations of 1.4 billion. Africa can and must do better to strengthen their healthcare systems. Now, Ambassador, having said this, we are aware of the partnership you have established with Morehouse School of Medicine in the exploration and research on natural medicines in Senegal. Knowing the difficulty that Africa has experienced in getting approvals from the Federal Drug Administration, FDA, and other agencies to help bring African medicine to the global marketplace, in light of this pandemic, Ambassador, how do you see Africa taking a leadership role to help scale up and find new solutions to help heal their nations? Ambassador? Okay. Thank you.
Hello?
Yes, sir, go ahead, please.
Well, now it seems to me that Africa's doing better than we are, and especially Liberia. And I would say that in the Ebola crisis, the Center for Disease Control put a unit in Africa and worked directly with you so that you were able to contain it there. Well, I have a lot more faith in strengthening lifestyles than I do in, well, I'm hopeful that we will have a virus soon. I mean, a vaccine soon. Once we have a vaccine, it ought to be made available, but not until it's been thoroughly tested. And I think that, frankly, Africa's probably better off right now staying out of American politics. And I think that we have so many African physicians here in Georgia. I think one of the things we might do is call on them to find a way to work with you with their homelands directly, because, well, we broke the link with the World Health Organization. I would hope that that would be repaired soon.
Yes.
But in the meantime, I'm thankful that you're doing so well. Senegal, for instance, during the Ebola crisis, had very few, if almost no Ebola. And the exchanges that you would have with each other, Ghana, I understand, has made some significant advances in cancer treatments. And so instead of looking direct only to the United States, we're trying to get Morehouse and Howard University and Meharry working with your positions there and with your health departments to make available any new finds and new research that we do. But this frankly caught us unprepared.
Yes.
And I'm hoping that you can get prepared without waiting on us to tell you. I mean, I went to school with people from Liberia, Nigeria, Ghana. They were all smarter than me. A lot of them came here to live, but they maintain connections. And I think we've got to maximize those connections as we build a new future through the United Nations, through UNESCO, UNICEF, and Africa works the international agencies, frankly, better than we do in the United States.
Well, thank you, Honorable Ambassador. Thank you so much for that. We know of all the good work you are doing on the natural medicines on the continent, and we look forward to learning more about the research that Morehouse School of Medicine is undertaking. We'll check back in with you at a later time to see if there are any other updates you can provide. So we're going to move along. Yes, sir.
I can say one thing, that when the presidents of Africa came to visit President Obama, I asked one of my friends from Senegal to send me a shoebox of their herbs that they use. Morehouse Medical School cooked it down into an extract, and we sent it to the place where they keep all of the live viruses. And this extract of African herbs in petri dishes, they put a few drops in each dish, and at that level, it killed every kind of virus that they tested it with. And those were just herbs that are growing in Africa, wild. But African leaders and physicians have maintained connections with their African traditions. And so hopefully those can be made available to the rest of the world. We could not get additional money for testing this extract. Though Morehouse is now testing it, but I don't think they're testing it with human beings yet. But we've had to close down the medical school because of the virus is so bad here. And they're just now opening, and they're on, they have worked out a method of study where I understand they're working in groups of 10 only, and maintaining some separation and isolation while still interacting with each other and with their professors. So, but that is just happening. I think that just started this month in September. So as we learn, though, we'll stay in touch with you, keep them in touch with you. And we're really grateful that you keep a connection going between us and remind us of our connections to the motherland.
You're so welcome. Thank you, Ambassador. And again, if you are needing any additional support, letter writing campaign to the legislature, to Congress, we have a good group of people who would be more than happy. I think Africa certainly can take a leadership role, particularly now as Africa has been isolated during this virus. There are a lot of leaders on the continent, physicians, research scientists, and I just believe Africa has many of the answers that we need. We just now need to get the support to get it into the marketplace. So thank you very much, Honorable. I'll now turn the next question. We're getting ready to open up and have our last questions for our panelists, but this is now for Honorable Sherman. Liberia is one of the first countries to test for the coronavirus, as we mentioned earlier, at the Roberts International Airport. As the coronavirus has impacted travel to Liberia and other parts of the world, in particular, how are consulates and embassies handling requests for passports, visas, and other Liberian documents? And what new protocols has the consulate in New York established for requesting these documents in an effort to keep staff and customers safe and healthy? Honorable Sherman?
Thank you, Cynthia. And again, thank you to all the panelists this morning. With the coronavirus hitting us so hard, obviously we all had to shut down and we were all shut in for a long time. And because we were particularly hit hard here in New York, opening up, we had to think long and hard about how to open up without compromising safety or compromising services. What we did was we decided to purchase a lockbox, for example, where applicants could drop off all of their applications, and we would then be insulated from human contact. And we posted on our webpage that we still would offer all services, but only through mail. So far, has been successful. Everybody has cooperated, and they've understood that that New York was so hardly hit, we couldn't take a chance of having crowded waiting rooms anymore. So that's the first step. We decided to provide everything by mail, or you have access to our very safe lockbox right outside of our office. The next issue was providing passport service. With the passport service, obviously we couldn't do it by mail because you have to do biometrics. We had to do fingerprints, we had to do digital pictures and whatnot. And so we altered our processing, where if an applicant had an appointment to come in for passport service, we would then go the extra step of calling them and rescheduling their time to ensure that there were only 3 people available at a time to come in for passport processing. We're strictly enforcing that they only come in alone. You don't come in with a guest or family member, because again, we have to consider safety for our staff and for them as applicants. So far, we still provide all available services, but we do it by mail only. So for visas, for travel documents, for authentications, for whatever it is, we encourage people to do it by mail. We've updated our website, and we've updated our answering service so that everyone can call in and understand that we do by mail. We do our best to try and call applicants back. And also we've listed on our webpage the Liberian Airport Authority regulations. Mm-hmm. As you stated before, we're one of the first to do testing at the airport upon arrival, but they also offer you the opportunity to do your testing here just prior to departure. And with that certificate, you can go into Monrovia and your protocol will be a little different. So yes, we reopened, but we do everything by mail, and we try our best to provide all the services available through mail. Thank you.
Thank you very much. At this time, I'd like to have a second question go to Honorable Bishop McCloud. Bishop McCloud, as you and the Liberian Nurses Association USA have officially launched the fundraising campaign for medical supplies, PPE, and other equipment, please let us know and share with the listening audience how the campaign is coming along and how people can get involved. Again, I know you have a big announcement to make about a contribution that came forward on in-kind basis, so I'll turn it over to you, Honorable. Oh, microphone. Oh.
Thank you very much. The contributions are frankly slow, and I think they're slow for several reasons. So far, our association with the Liberian Nurses Association is pretty new. So we've raised somewhere close to $2,000 US. One of the reasons I think it's slow is because of the political season now and the number of requests that are coming from political people in America, and the fact that there are so many people in America who are unemployed now and not able to make financial contributions who would otherwise make them. But I am very pleased to share with you that we've had 20,000 face masks donated from the eastern area of the Links Incorporated and the Women's Missionary Society of the AME Church. The Links Incorporated is a group of women in the United States who do a lot of philanthropic things. My wife happened to serve as one of its presidents some time back. But those masks are now with Liberian Shipping Company in Rhode Island and headed to Liberia. But in addition to just so many people just think about Monrovia when you talk about Liberia, there is an interior area of Liberia that is extremely difficult to navigate. And we have churches and people in those areas. And I'm so happy that the AME Church in the United States over the last 6 months has given us more than $125,000 US that we send about $20,000 per month to try to help put food on people's tables and keep our churches and people moving in a proper direction, because they have not been able to meet. But we are beginning to reopen our churches slowly. But I am grateful for those contributions. Now, if people want to make contributions to the effort that the Liberian Nurses Association is joining with us in making, Cynthia gave out the website, the PayPal website address, www.amec14.com. And you just scroll down to the bottom where it says giving or donation, and you can give as much as you would like to, and that would go directly to the Liberian Nurses Association, who are planning a trip and to provide some additional medical support as they did during the Ebola crisis. You can also mail checks to the 14th Episcopal District of the AME Church to Post Office Box 310043, Atlanta, Georgia 31131. I think those contributions are going to pick up after this webinar. I think they're going to pick up after we elect a new president in the United States. I'm looking forward to that. God bless you all.
Thank you, Honorable Bishop McCloud. I mean, this is outstanding. Again, the numbers we talked about earlier in the week didn't have this particular number on the 20,000 facial masks donated by the Links Incorporated and the AME Church. This is outstanding, along with the other donations that are coming through to help sustain the local churches in light of COVID. So Ambassador Patten, I'm sure you'll be quite pleased. I'll be working very closely with the Honorable Bishop to ensure that the matching fund program is filled out properly, because if we're talking about 20,000 facial masks and the value of that and the 125,000 in cash, that is going to bring about, I think, a very nice match. So thank you, Honorable Bishop McCloud, for your outstanding efforts. The next question will go then to Honorable Jackson George. Honorable George, the African economy was set to grow at about 3.4% in 2019 and projected to increase to 3.9% in 2020. But obviously the COVID-19 crisis has had a very negative impact. As the World Bank expects the African continent as a whole to experience its very first recession in 25 years, the African Union fears some 20 million jobs will be lost in the course of this year. Liberia, being one of the poorest countries in the world, it has some of the greatest resources, from rubber, oil palm, iron ore, gold, diamonds, and of course, tourism. How do you see LIBA's role, the Liberian Business Association's role in working as a bridge to help connect Liberian businesses in the diaspora and the U.S. private sector to help with business opportunities in Liberia? Thank you, Honorable George.
Thank you, Cynthia. There's no doubt that the COVID-19 have impacted business in Liberia, the economy. And so, as I normally say, LIBA, the Liberian Business Association in the diaspora, is strategically placed to partner with businesses in Liberia to get our economy started. One of the things that we must understand through this COVID is that we need to be organized and we need to build strong institutions. And if LIBA Diaspora, while we've taken the chance to identify the resources in the diaspora and to leverage our potential here, we have to take care of ourselves in the diaspora. But at the same time, we have to understand that ultimately, we in the diaspora have an obligation to our homeland. And that obligation for how well we are doing in the diaspora, we must be able to translate that, our skills and our resources in helping to rebuild our homeland. And so I see a strategic partnership, public-private partnership between the diaspora and Liberia and through businesses on that end. I think it's a mindset issue. And my plea to Liberians in the diaspora is that we must make an intentional effort to understand that we must contribute to our homeland in terms of partnering with businesses down there. One of the things that we've come to realize and accept that many of us in the diaspora will not go back home to live or to stay. But there are businesses in Liberia that we can partner with and still contribute to the economic development of our homeland. And ultimately, only Liberian can ultimately develop Liberia. We encourage foreign investment, we encourage our partners, but we need Liberians to have stake in the redevelopment of our homeland or the economic development of our homeland. And that is why LIBA Diaspora is very strategic and in working with partners in Liberia. We are looking at the tourism industry, we are looking at partnering with the Chamber of Commerce, the Liberian Chamber of Commerce, the Liberian Business Association. This is a holistic approach that we may take. So the short-term goal is to continue to build relationship, continue to see us working through institutions. The idea of an individual doing business in the United States without going through the institution makes it difficult. And so we have taken few missions to Liberia. I will be going to Liberia again to help strengthen the institutional building that we're working with LIBA, the Chamber of Commerce, the tourism industry, to ensure that this partnership live. And I, as I tell you, Liberians in the diaspora, especially we who are business owners and we're doing well in the United States, must make it an intentional effort to help our homeland. And so we are doing that. We are working on that. It's not an easy effort, but I can guarantee you for where we've come, we are focusing our attention on how we can partner with businesses in Liberia to make that happen.
Thank you, Honorable Jackson George, for your leadership. Please keep us in tune and informed to see how we might be able to assist you further in providing any kind of support for you. So ladies and gentlemen, at this time, I'm working with our technical team. We're excited to share with you our videos. As I mentioned at the top of the hour, the president and the vice president of the Liberian Nurses Association, USA, we've done a pre-recording of them prior to today's event. unfortunately, due to their work schedule helping to combat the coronavirus in the USA, they were unable to join us live. So I'm checking in with my team now to see if we are ready. It says yes, so I'm going to turn it over to the technical team. And if you can run these short videos, I greatly appreciate it. And then we're going to have a quick Q&A and then announcements, thank yous, and next steps. So I'll turn it over to my team. Good morning. I'm delighted to be here today. My name is Cynthia Blandford, and I have the honor and privilege of introducing a very dear friend and colleague of mine. And her name is Miss Amelia Togba Addy. She is the president of the Liberian Nurses Association USA in Atlanta, Georgia. So the question is, Madame, as president of the Liberian Nurses Association USA, please share with the listening audience your vision and the purpose of the organization. I'm sure they want to learn more about how this organization is structured, what type of activities you have going on, how the board is put together. And again, we'll talk a little bit more about any special projects and initiatives. But very specifically today, tell the audience about the vision and purpose of the Nurses Association for Liberia.
Great question. The vision and purpose. Why are we here? Why was the Liberian Nurses Association USA formed? Well, let me tell you a little bit about our inception. The Liberian Nurses Association USA is an organization that was birthed in 2011 for the mere purpose of promoting excellence in healthcare through education, through leadership, and service to Liberians and non-Liberians. We've held community health fairs. We've partnered with on different levels with different groups in the Georgia area. We especially want to make a difference in the healthcare delivery system in Liberia by developing actions and initiatives that will foster sustainable healthcare for the Liberian people. The organization currently has about 50 members on the books. So we are a small organization. All 50 are not active. We're hoping that someday all 50 will be active, but the ones that are active have been very diligent in fostering the goals and the mission and vision of the organization. We do have a board of directors, and we are a nonprofit, a legal nonprofit organization here in the United States. We are also partnering with the Liberian Nurses Association in Liberia. So there's a joint partnership there.
Outstanding. What an incredible vision that you have for the organization. The need is great. And I'm hoping that the listening audience for the webinar will recognize that we will get beyond COVID-19. So the long-term sustainability aspect of healthcare is going to be very important on the continent, particularly in fragile healthcare systems like Liberia. And we certainly want to wish you very well and much success in your endeavor. And please feel free at any time if we can assist you with helping to plan a medical mission. We'll dig deep with our resources to get you on a flight with some of our partners, get on the ground and help to build this incredible maternal waiting area and hospital and room for mothers and children to come. So congratulations on that incredible vision, and we wish you much success. So Amelia, as we begin to wrap up today's questions for you as the president, I want to say thank you so kindly for your leadership and for your outstanding support. I also want to make an announcement to the listening audience for more information on how to make a contribution to the COVID-19 fundraising campaign, co-sponsored by the Liberian Nurses Association in collaboration with the High Bishop over Liberia, Cote d'Ivoire, Sierra Leone, and South Africa. Please feel free to go to www.amec14.com. That's www.amec14.com, or send a check made payable to 14th District AMEC to P.O. Box 310043, Atlanta, Georgia 31131. And of course, for those who may want to reach out to Amelia directly as the president, feel free to contact her at 678-472-6018. And ladies and gentlemen, you can always go to our website, the Liberian Consulate website at www.liberianconsulategA.com. Again, we want to say a special thanks to our sponsors, Icon Filmworks and J-Lane Media for their support. And we appreciate you, Amelia Togba-Addy, as the president. We wish you all the much success for all the good work to come. Is there one parting word you'd like to take at this time?
Yeah, once again, thank you, and thanks to everyone, organizations, individuals that have been working so diligently to help bring relief to the Liberian people as it relates to COVID or just general healthcare. So we appreciate you, Cynthia. You know, we appreciate you always. Thank you to everyone, and we look forward to great things happening for the country. Thank you.
Thank you so very much, and a special shout out to Dr. Bishop McCloud. Thank you so very much, and have a great rest of the morning. Thank you. To the webinar, COVID-19 Liberia Response. Welcome, Tony. We're very happy to have you this morning, and I have the distinct honor and pleasure of introducing not only a colleague, but a friend, Mr. Tony Nimley, who happens to be the Vice President of the Liberian Nurses Association, USA, located in Atlanta, Georgia, who has done some outstanding work to help strengthen Liberia's healthcare system. Good morning, Tony.
Good morning, Cynthia. Thanks for inviting me.
Thank you very much for coming. Thank you so very much. At this time, I will present a few questions for you to answer regarding the healthcare system in Liberia and COVID-19 pandemic that will help give the audience an opportunity to learn more about your organization and how they can help. So the first question is, I remember when you and the Liberian Nurses Association traveled to Liberia during the Ebola crisis to help lend support, including delivering medical supplies and equipment in 2014 and 2015. As Vice President of Operations, you have been involved with the Liberian Nurses Association for many years. Please share with the audience, how did you and the LNA USA respond during the crisis, the Ebola crisis, where thousands of Liberians died, and what impact did your work have on saving lives?
Well, as the Vice President of the Liberian Nurses Association, in my capacity as an ardent leader for this organization, I saw it as a very expedient action to make in terms of facilitating strategic efforts in assisting Liberia during the Ebola crisis. We quickly sprung into action by soliciting the help of the WellStar healthcare system in Atlanta, Georgia. We saw that a quicker action was needed. So in order to assist the people in Liberia, we needed funds that should be appropriately allocated in purchasing PPE for the Liberian people and Liberian professionals in particular to help battle patients that have fallen victim to the Ebola virus at that time. So when we did that, every opportunity that the WellStar Healthcare organization gave us, we used that opportunity to purchase materials. We had a strategic planning, as you know, with your help also, to make sure that we're able to get to Liberia, not only with personal protective equipment, but with necessary educational materials and with training equipment in terms of workshop that we're going to organize in Liberia to train medical professionals to have the appropriate tools in helping patients and educating nursing professionals in order to go out there and properly execute the plan of care.
Thank you for that. And as we conclude our session with you today, I might mention that with 25,000 Liberians in the state of Georgia, if each Liberian gave $1, that would raise enough for a container of medical supplies and equipment. If by chance we have more than 250,000 Liberians in the United States, if each Liberian gave $1, we could send many containers, many ventilators to Liberia to help save those who are affected with COVID-19. So Tony, I want to say a very special thank you for your time and your talent and your treasure, all that you have done to contribute to the Republic of Liberia, both here and home. And I'd like to say also a special thanks to our partners, J Lane Media, for assisting us tonight in our session. For more information on how to make a contribution to the COVID-19 fundraising campaign, please visit www.amec14.com, www.amec14.com, or you can send a check made payable to the 14th District AMEC Church, P.O. Box 310043, Atlanta, Georgia 31131. You can also call Tony Nimley at 470-295-1550. And again, for further information, always feel free to go to the Liberian website at www.liberianconsulategA.com. Thank you very much to the Liberian Nurses Association of Georgia for your time, your treasure, and your talent. Thank you. Taking the time out today to join this important webinar. As we're getting ready to close out our webinar for today, I want to turn it over again to His Excellency George Patten, the Ambassador to the U.S. From Liberia in Washington, D.C., to have a call to action, and then we'll close out with thank you and final remarks. So Ambassador Patten, please.
Thank you, Cynthia. I want to thank you again for organizing this webinar, and I want to thank the U.S. government for the continued support the Liberian people have been receiving over the years. We look forward to the support. It is critical for the country, for the economy, for social progress, for development. We want to again thank Ambassador Young for the contribution he made, and to also thank our friends, Liberians in the diaspora, people from the business community, people from the health sector who have been contributing to medical services and reaching communities for food and other items, ensuring that Liberian people remain alive and that COVID does not take them. We want to use this platform now to appeal to our friends, good friends, to members of Congress, some of whom we've reached in the last couple of months. Liberia faces critical times, budgetary support, little growth that we had anticipated has been wiped out by the outbreak of the coronavirus. We hope we will have our friends coming around us. We know the effect of the outbreak on major economies that have almost collapsed, but we still look forward to strengthening our bonds and friendship with our friends in globally, and we still hope that they will come around and help our country. Coronavirus is a deadly disease. I've experienced it. It is no joke. It's important to fight it and make sure it goes away. And so with regard to the USAID matching fund I was just talking about, is 4.6. The USAID is making available. All we're asking our friends and humanitarian institutions to do is to sign up to that portal. Whatever contribution, even if you have made it before a couple of months ago, it can still be accounted for. To sign up to that portal and get your donations accounted for. USAID has made a commitment that they will match it. It's 4.6. We want that money spent in Liberia for social progress, for vulnerable people in our society. So we want to thank you again, our diaspora groups in the States and in Canada, who have been working with us, the Ebola task force that has been run by Dr. Jeffrey. It's been very, very viable. We understand they are expanding beyond the corona now and going into business activities. We encourage them to continue to bring the Liberian people around. Thank you again, Cynthia, for this meeting, and we look forward to other webinars to be able to speak about Liberia and solicit assistance for our people and our country. Thank you.
Thank you, Ambassador. And I want to also say a very special thanks to you as our keynote speaker for bringing this great message to us today, and for your continued healing from the coronavirus. We thank you for taking the time. And to our distinguished panelists, Ambassador Andrew Young, Bishop Earl McCloud, Honorable Rudolph Sherman Jr., Honorable Jackson George, for bringing the perspective on what the diaspora is doing to help support Liberia during this virus. A special thanks also goes to our nurses, Amelia Toba Addy and Tony Nimbley, for the work that they are doing on behalf of the coronavirus to raise funds for PPE, medical supplies, and equipment. I also want to say a very special thanks to our sponsors, Global Strategies for Good, the University Consortium for Liberia, J Lane Media, and Icon Filmworks, and to our planning committee. We couldn't have done this without the support of our Connect Liberia Planning Committee, which includes Candace Bazemore, James Hammond, Dr. Saki Gulafali, and Chris Barry. Thank you for your leadership. Ladies and gentlemen, we want to also say, please stay tuned to future Connect Liberia webinar series. We'll have some coming up very soon. Africa Free Continental Free Trade Area, providing access to Africa's 1.2 billion population and 2.5 trillion in economic output, e-learning and e-commerce Africa, and Africa travel and tourism, travel routes, airlines, and COVID-19 airport protocols. For more information, please go to our website. We'd be very happy to include you in on the next webinar. So ladies and gentlemen, thank you so much to you and your time and your talent today. We look forward to seeing you on the next one. Blessings to all of you. Stay safe and healthy and have a great rest of the day.
Thank you, Cynthia.
Thank you. Thank you, Mr. Kumar.